Men are more common to have colorectal cancer than women, but if you put men and women together, it is the third most common diagnosed cancer in the population and the second leading cause of cancer-related death. The problem with most of the signs and symptoms that are discussed that you commonly know of, rectal bleeding, abdominal pain, nausea, vomiting, and bloating, all of those occur relatively late in the course of a colon cancer. If you think about it, the colon is a pipe. Cancer is a bump that's growing on the inside of the pipe. For the colon cancer to become symptomatic, it has to do one of two things. It has to get large enough to where it blocks the pipe, to where nothing can flow past, and that's called an obstruction. Or it can grow through and outside of the pipe into a different organ, which would cause pain. Bleeding, the tumors have to get large enough to where they become ischemic on their surface, and they outgrow their blood supply before they start bleeding. So usually if you're developing symptoms of abdominal pain, diarrhea, abdominal pain, change in bowel habits, bleeding, you have an advanced lesion at that point in time. Screening is very important. Since we began screening for colorectal cancer in the mid-1980s, the incidence of colon cancer has decreased 2% per year. It is very important to screen because 95% of cancers develop in a stepwise form from a colon polyp before they turn into a cancer. Usually the worst part of the colonoscopy is the prep, and people have nightmares about the prep. But the procedure itself is safe. Now, there are other ways to screen for colon cancer. There are stool-based studies with fecal occult blood and new fecal DNA studies. There are radiological procedures. There's a barium enema or CT colonography, but the gold standard remains a colonoscopy.